Hi, I'm Dr. Dhanvanti, and you are watching Anatomy of Bias.
Today, I would like to share this case of a patient of mine. He was having vitiligo since he was 12 years of age. It was distributed on his palms, on his soles, on his face, these areas where it's very difficult to conceal. Because he hailed from a community where vitiligo was considered a curse, and families who have vitiligo, the village would banish that family. So he had been to many doctors. He had been to Ayurvedic practitioners, homeopaths, and even people who can do some mantras or tantras to help them. Then he was 12 years when they started seeing some patches appear. So they actually moved to Mumbai, where people at least don't take you off the community. And then I saw him when he was 18, when he told me an incident when he went to college when he was 17. On the first day itself, when he opened his dabba and there was bindi or somebody's food, he took the bindi. After that, nobody ate that lady's finger dish which was there, and that really shattered him. He said that I'm just gonna give my life up. But then somehow, for his parents, he kind of got out of that. He started going back to college, and in fact, in college, he started this whole group where he could support other people having other problems. So it was a journey which he told me, and I realized that how he himself had to stand up against this whole stigma that was put for him.
Do they assume that it's communicable, it's transmissible? Is that the erroneous belief?
I think so. I think that most people are worried that if they take food also, if suppose they get the disease, then and any which ways, it's not a disease per se. It's actually just a cosmetic concern. If you see graying of hair, a lot of people and a lot of us gray hair pretty young these days. By 35, I see so many of my friends who have used hair color. But when they have gray hair, nobody even bats an eyelid. But this similar thing where the skin loses color, it's considered a big, big curse because of the myth that it is a communicable condition. And
So tell me, this boy that you mentioned, was it easy for him to have a successful personal life?
most patients are worried about the wedding as the biggest problem. Like they feel that because of the disease, they will not be married at all. They will not, because they have had multiple rejections in these, because of any white patch. So it's companionship for even the patients having vitiligo is a problem, or even if they have a family member who has vitiligo is a problem. So it does have a genetic predisposition because families do have it, but if they get like 100 babies, out of that 7 or 10 may be affected by the vitiligo. There are obviously couples who have, once they get the disease after the marriage, most couples accept each other. But at the end, there's a big stigma which is there.
Is there support amongst people with vitiligo for one another, or are they stigmatizing one another also?
So, Dhananti, that's a really, really important question you brought, because when I see most of my patients who come to me, and if they see another patient in the waiting area who may have the same condition, they actually come and say that at least mine is not on the face.
And is there a cure for this, Dr. Dipti?
Cure would be something like where, like if you had malaria, but this is something more chronic. If you say like a diabetes or hypertension, where we can control it well, but there's a lot of research happening which are really good to treat and at least stabilize this condition. So we all who are the vitiligo researchers from the world are quite excited for these new drugs which are in the pipeline. Currently, they are in stage 2 and stage 3 of clinical trials, and soon in the next few years, there is going to be a very robust treatment options available for this condition too.
And how is your patient done, the 18-year-old boy who was really heartbroken on the brink of suicide with this kind of social bias that he experienced? How has he done after he formed a support group?
So I think when I have been seeing him, he's formed this very good network of people. So they formed a network, they're supporting each other. And I think this whole journey, what he went through, like using this as his strength, I think he's become a role model for a lot of people. So